Gary Hill.
Yes.
Hi, come and take a seat. I'm Dr. Giam. Hello.
Hi.
What can I do for you today, sir?
Yeah, I've basically been sort of experiencing some chest pain for a while, for the last few weeks.
Okay.
So, yeah, I thought I'd better come and get it looked at, really.
Yeah, absolutely. Okay. Just take me back to the beginning. When was the first time you noticed this episode of chest pain?
About 6 weeks ago.
Right. And what exactly were you doing 6 weeks ago?
Well, I was at the gym. I've just recently renewed my gym membership.
Yeah.
And I was bench pressing a barbell. I haven't done it for a while.
Okay.
And I first noticed it then, I was, I was lifting the bar, and I felt this pain in the middle of my chest.
Right.
And I kind of thought,
yeah,
sprained a muscle here or something.
I see.
So I put the barbell down, the pain was still there. I went and got changed and went home, basically.
Okay.
Yeah,
so how long did that episode actually last for?
Well, it was still the pain all the way home. And then when I got home, I took some painkillers.
What did you take?
I took Nurofen.
Okay. And did that help?
It did. It still took a while, but it did get rid of the pain, yeah.
And when you say a while, how long exactly did it take?
Probably 20 minutes, half an hour after.
20 minutes,
yeah.
half an hour,
Yeah.
I see. And during that time, did you feel short of breath at all?
No.
Did the pain move into your neck, down your arm?
No.
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 And you described the pain, was it sharp or more just an ache?
Yeah, an ache.
An ache,
yeah.
I see. And you didn't feel sick with it?
No.
Didn't feel sweaty with it?
No.
Okay. Now since then, what's been happening? So that was 6 weeks ago. Have you had any further episodes?
Yeah, well, for sort of two or 3 days after that, I had this achy pain, this sort of pain again.
Yes.
So I took some more painkillers.
I see.
Yeah, and I've had sort of various chest discomfort over the last 6 weeks.
Okay. And when you get this achy pain, what exactly are you doing? So, for example, take me back to the most recent episode.
Well, most recent one, I've been getting this like heartburn sort of pain.
Okay.
I had that last night.
I see.
When I was in bed.
I see.
It just sort of came out of nowhere, really.
Okay. So if I just get this straight, are there sort of two types of pains that are happening here? A sort of heartburn type pain.
And a sort of achy.
And a sort of an achy pain.
Yeah.
Okay.
Yeah.
I can see in the notes that you've had some problems with heartburn before. What was that related to?
Stress, really. I think it was attributed to. Not a great deal was done about it.
Yeah. And when was that?
A few years ago. I've had it intermittently. I've occasionally had heartburn.
Okay. And the episode of heartburn that you had last night, that feels quite similar to the sort of heartburn that you've had before.
Yeah.
Okay. Have you had to take anything for that?
I usually use Gaviscon, and that kind of does it.
Down.
Yeah.
Your bowels are okay.
Yeah.
Appetite all right.
Yeah.
Weight's okay.
Yeah.
Okay. With regards to the more achy type pain now, when exactly does that tend to come on? So when was the most recent episode of the achy type pain?
Well, that was last weekend. I was playing football over the common, and I had this sort of achy pain.
So that came on with exertion?
Yeah, I was running for the ball, playing for about 20 minutes, and then I got this pain, and obviously stopped playing.
Yes. And how long did it take for the pain to go away after that?
20 minutes, I suppose. 15, 20 minutes.
15, 20 minutes.
Something like that.
Did you feel short of breath during that?
On this occasion I did, yeah. Yeah, I did feel short of breath.
And that's unusual for you?
Yeah.
The pain didn't go into your arm, your neck on this occasion?
No.
No. And you didn't throw up?
No.
No sweatiness?
No.
No. Okay. So you've had this achy pain now playing football and at the gym. On any other occasion, at rest, does it ever come on?
Never come on at rest. It happened again a couple of weeks ago.
Yeah.
When I was playing football.
So 2 occasions.
Yeah, I didn't get short of breath on that occasion, but I had a similar sort of pain, and it stopped me.
Yeah.
You know what I mean? I had to stop playing and sit down and rest.
Yeah. Well, I mean, I can understand. Obviously, that can be a bit concerning when you're getting pain like that.
Yeah, it's not ideal, is it?
Yeah. Had you any thoughts yourself as to what was causing it?
Well, I mean, the pain, in your chest when you're exercising. I mean, I'm a little bit concerned that it could be coming from my heart, if I'm honest. Do you know what I mean?
No, I think that's totally reasonable.
And
certainly I think that's something that we need to consider.
Right.
I'd like to ask just some specific questions around that, if I may.
Yeah.
Is there any family history of heart problems?
There is, yeah. My dad and my uncle, my dad's brother, have both got angina, and they've gone on and developed heart problems, heart disease,
I'm sorry to hear that.
Thanks.
How old were they when they first developed these problems?
Early to mid-50s.
Okay. And were they smokers at all?
Yeah, they were, yeah.
Okay. And what about yourself? Do you smoke?
No, don't smoke.
You've never smoked?
No.
Okay.
No.
There are sometimes other things that can affect the heart, such as alcohol.
Yeah.
Do you drink any alcohol?
I do, moderately. I don't know, between 5 and 10 glasses of wine a week, or, a few beers. Do you know what I mean? Nothing sort of alarming. I'm not a big drinker.
Sure.
Yeah.
Appreciated. In terms of history of diabetes, have you ever been tested for that?
I haven't. My mum's got diabetes, though.
I see. Okay. And high cholesterol?
Not that I know of, no.
No. Ever had your blood pressure done?
Long while ago, I think.
Okay.
I don't think.
But you're not on any regular medications for any of those sorts of things?
No.
Nothing.
No.
So it's just only the Nurofen that you were taking?
Yeah.
And have you stopped that now?
Yeah, I have, yeah.
I see.
Yeah.
Okay. I mean, I can hear that it's obviously affected your football. Has it affected anything else at all?
I wouldn't say it's sort of directly affected anything,
No.
I suppose. I'm still working and all that, but I'd probably be a bit reluctant to go and play football again this weekend.
Appreciate
do
it.
you know what I mean?
Yeah.
Or to go and do any exercise,
Until it's
because
kind
I'd
of
have this sort of
sorted
thing in the back of my mind that.
Yeah, I
so
think
it's,
that's sensible.
Yeah. It's not
And what work is it that you do?
Property. I'm a property developer.
And everything's all right with work at the moment?
It's as good as it can be, you know what I mean? I do all right, I make a living, but it's stressful and it always, that's just the nature of the job, really. But it's okay.
Appreciated. So just to recap, 6 weeks ago, this episode of chest pain, which you described as an ache, I've had a couple more episodes of that recently.
Yeah.
Coming on with exertion in particular.
Yeah, definitely.
And also your heartburn sort of coming back as well. Is that correct?
Yeah.
And obviously you want to get it checked out. Your
Yeah.
concern being, is it coming from the heart?
Yeah.
I think that's perfectly reasonable.
Okay.
If you don't mind, I'd like to examine you now.
Okay.
And then we'll take it from there.
All right.
Okay.
Yeah.
Just follow me through to the
Cheers.
examination.
Thanks.
Okay, Mr. Hill, just take a seat there on the couch.
Thanks.
Just going to have a feel of your pulse.
Okay.
Take your blood pressure now. Going to have a good listen to your heart. I'm just going to have a feel of your tummy. Can you just tell me if it's tender anywhere at all? That's a bit sore.
Yeah.
Okay, sorry.
Yeah, that's right.
Okay. Just follow me back through. Thank you.
Okay, cheers.
Take a seat.
Thanks.